Welcome back to another deep dive. Today, we've got a really incredible topic for you, our curious listener, and we're tackling a massive question. Do polynucleotides actually boost collagen and elastin?
Yeah, and to answer that, we're pulling from just a fascinating stack of sources today.
Right, we've got clinical trial data, medical device specs, doctor's notes on menopause, and even aesthetic medicine journals.
It's a lot of ground to cover. But the mission of this deep dive is to really untangle the science of tissue regeneration. We want to explore how this DNA-based technology is being used to treat some of the most overlooked yet universally impactful conditions in women's intimate health.
Exactly. And to understand how these polynucleotides work, we actually have to talk about, of all things, trout and salmon sperm.
Right, which always surprises people.
Oh, totally. We're talking cellular blueprints and why the beauty and medical industries might have been, approaching collagen completely wrong for decades by relying on this idea of, well, controlled damage.
Yeah, we've really been going about it the hard way. But to understand why this new approach is so revolutionary, we first have to set the stage, right? We need to understand why we lose collagen and elastin in the first place.
So where do we start with that?
Well, to really get collagen, we have to look at genitourinary syndrome of menopause, or GSM, and vulvovaginal atrophy, which is VVA.
Right.
According to the sources, it all comes down to estrogen. When estrogen drops, and that could be due to natural menopause or, anti-estrogen cancer meds or even some birth controls, the estradiol levels just plummets.
It's like off a cliff.
Exactly. We're talking premenopausal peaks of like 800 picograms per milliliter dropping down to below 30.
Wow, from 800 to under 30, that's a massive hormonal cliff.
It really is. And that cliff causes the fibroblasts, which those are the cells that actually make the collagen, to just power down. They become dormant. They turn into what we call fibrocytes.
So they just stop working entirely.
Pretty much. And because of that, women can lose up to 30% of their skin collagen in just the first 5 years of menopause.
30% in 5 years. That's just staggering.
Yeah. And in the vulvovaginal area specifically, it's even more complex. The collagen and elastin fibers deplete, but they also fuse together. They hyamelinize.
Which means they get kind of stiff and glassy.
Right. And on top of that, glycogen levels drop, which means the healthy lactobacilli in the microbiome die off, and the pH rises above 5.
Which basically invites in all the bad bacteria. Okay, let's unpack this, because the human impact here is it's severe. The sources talk about severe dryness, itching, tissue fragility where the skin literally thins out, and dyspareunia, which is painful sex.
Extremely painful.
I like to think of it's like a mattress losing its springs and its padding simultaneously, The structural integrity just collapses, making everything incredibly uncomfortable.
That's a really good analogy.
Yeah.
And we connect this to the bigger picture. Nearly 50% of postmenopausal women suffer from this within 5 years. 50%.
Of all women, and yet nobody talks about it.
Exactly. It's vastly underreported, which sets up this really desperate need for treatments that can somehow rebuild that lost collagen and elastin matrix.
Right, which brings us to the fixes, or I guess the flawed fixes, because we had a listener question pop up that was addressed in the UB doctor's note. Can I just take or apply collagen?
The collagen supplement myth.
Yeah, you see it everywhere. But the source gives a major reality check here. Oral collagen just gets broken down in digestion. Your body just turns it into amino acids and decides where it goes. It definitely doesn't naturally beeline for vaginal tissue.
No, it doesn't prioritize that at all.
And then even topical creams, the topical collagen molecules are just too large to penetrate intact skin. They literally just sit on the surface.
Right. They might moisturize a bit, but they aren't rebuilding the structure, which is why doctors have had to turn to clinical interventions.
Like lasers.
Yes, energy-based devices. The sources talk about fractional CO2 and ERYAG lasers. And the way they work is they are used to heat the vaginal connective tissue to about 40 to 42 degrees Celsius.
Which is really hot for sensitive tissue.
It is. The goal is to create controlled thermal injury. The idea is that you force the body to repair itself by causing edema and triggering new collagen production, which is called neocollagenesis.
Wait, so we are essentially burning the tissue to force it to heal itself?
Basically, yes.
That sounds like setting a house on fire just to force the contractors to show up and build a stronger foundation. It seems so counterintuitive, especially if the tissue is already compromised.
It is risky. And the FDA has actually warned against it. They've called energy-based devices for vaginal rejuvenation dangerous, stating there's no proven long-term benefit.
I'm not surprised, honestly.
The sources highlight this one really severe case study. There was a 65-year-old breast cancer survivor. She couldn't take estrogen, so she underwent 3 of these laser treatments. And upon resuming intercourse, she suffered heavy bleeding, 2 vaginal wall lacerations, and severe fibrotic tissue. Basically, intense scarring.
Oh my God.
Yeah, and it foreshortened her vaginal canal to just 2.5 centimeters.
2.5 centimeters, that is horrifying. The treatment completely ruined the tissue it was supposed to fix.
Exactly. Because the collagen produced by that kind of acute injury is often disorganized, scar-type collagen. It's rigid. It's not the flexible, healthy collagen she needed.
Wow. So burning the tissue is clearly not the answer, which finally brings us to the star of our deep dive today, polynucleotides.
Yes, PNs, or PNHPT.
Right. And these are highly purified DNA fragments extracted from the gonads, the sperm of male salmon and trout, which sounds wild, but it's pure science.
It is. It's incredibly precise.
So how do they actually work to answer our core question today? How do fish DNA fragments boost human collagen?
Well, the mechanism is really elegant. When the gel is injected, your body's own enzymes start to break these DNA chains into smaller fragments.
Just naturally breaking them down.
Right. And these smaller fragments specifically bind to what are called adenosine A2A receptors. And these receptors sit right on the surface of those dormant fibroblasts we talked about earlier.
The cells that shut down when the estrogen dropped.
Exactly. And what's fascinating here is that this binding completely skips the injury phase. There's no heat, no burn, no trauma.
Yeah.
It goes straight to the regeneration signal.
It just flips the switch.
Yeah. It triggers a whole cascade. The fibroblasts wake up and they start synthesizing new, organized, and structurally sound collagen and elastin. Not that rigid scar tissue, but healthy matrix. Plus, they produce natural hyaluronic acid and even stimulate angiogenesis, which is the creation of new blood vessels for better oxygen flow.
That is amazing. And the cellular data from the texts backs this up completely. The PNs increase p53 protein expression, which is a marker of DNA repair.
Right.
They improve mitochondrial density, and they actively suppress matrix metalloproteinases, or MMPs, and elastin.
Which is huge, because those are the exact enzymes that break down collagen.
Right. So here's where it gets really interesting. Unlike the lasers, which rely on a panic-induced repair job, polynucleotides are like handing the dormant construction crew a fresh set of blueprints, premium materials, and, like a cup of coffee, they just get to work building a structurally sound matrix without needing an emergency.
I love that. A cup of coffee and a blueprint. That perfectly describes the biological mechanism.
So we have the theory and the cellular mechanics, but how does this translate to real women? What are the actual outcomes in intimate wellness?
The clinical outcomes are incredible. The sources cite studies on a product called Nugan, which is a combination of PNs, hyaluronic acid, and mannitol.
And the mannitol is just there to protect the hyaluronic acid from breaking down too fast.
So exactly, it acts as a shield. So in a study of postmenopausal women, the symptom scores dropped massively by day 90. Itching went down by 76%.
76%? Wow.
Soreness dropped by 70% and dryness by 59%. And vaginal hydration specifically saw a 59.8% improvement.
That is life-changing. I mean, going back to the sources, there's that case study from the Rejuvemed clinic about a patient named Elizabeth, and it just grounds all these numbers in reality.
Her story is so tough to read.
It is. She suffered such severe atrophy that she literally couldn't walk without pain. She would wake up at night subconsciously scratching herself until she bled.
Which just shows how relentless the GSM symptoms can be.
Right, and traditional HRT steroids, estrogen, testosterone, none of it worked for her. It completely failed her. But a course of polynucleotide treatments finally gave her her life back.
Because it finally repaired the underlying structure that the hormones couldn't maintain anymore. And speaking of giving women their lives back, we have to talk about the PAIR study on sexual intimacy.
Oh, yes. This was fascinating.
It was a pivotal exploratory study by Palmieri involving 47 women. And what makes this so unique is the approach. Normally, treating deep inside the vaginal canal is difficult, right? It requires a speculum. It's painful for atrophic tissue.
Yeah, if you're already in pain, a speculum is the last thing you want.
Exactly. So instead of doing that, they just injected the PNs into the superficial vulvar skin just right before the hymenal ring. And they measured the results using the PAIR scale, which stands for Personal Assessment of Intimacy in Relationships.
And this was my absolute aha moment in the research
All right.
because they asked all these questions, right? And the 30 questions about the couple's non-sexual day-to-day relationship, like, do you communicate well? Do you share hobbies? Those didn't change at all.
Great. Their baseline relationship was stable.
But 5 out of the 6 questions specifically regarding sexual gratification improved significantly. For instance, the number of women agreeing that they hold back sexual interest because their partner makes them uncomfortable, that dropped drastically.
It's incredible.
By just restoring the organized collagen, the hydration, and the elasticity to just the superficial tissue, which, had a massive density of nerve endings, they fundamentally restored the women's sexual comfort and the couple's intimacy.
And they did it without deep, painful injections. By cushioning those hyperreactive nerve endings with healthy collagen, the friction stopped registering as pain and went back to feeling normal.
It's just brilliant. So to bring this all together for you, our listener, let's look at the core findings. Do polynucleotides actually boost collagen and elastin?
Yeah.
Yes, absolutely.
But more importantly, they do it by acting as a biological messenger. They command your own cells to rebuild a healthy, organized matrix, and they completely bypass the need for heat or injury or trauma. They offer this hormone-free, highly effective alternative for millions of women who are just silently suffering from GSM.
Yeah, and I want to leave you with the final thought to really chew on. We've seen today that polynucleotides don't just prompt collagen growth. They act as a primer that improves mitochondrial energy and actually stops those collagen-destroying enzymes in their tracks.
Right.
So if we can use these purified DNA fragments to simply instruct our cells to repair themselves and behave youthfully again, are we standing at the precipice of an entirely new era?
What do you mean? Well, think about it. Will injury-based medicine, like these intense lasers or harsh chemical peels or aggressive microneedling, will they soon be viewed as barbaric relics of the past? Can we entirely replace the old concept of healing through trauma with this new frontier of healing through genetic construction?
Wow, that is a wild paradigm shift to think about. Why burn the house down when you can just hand them the blueprint? Thank you so much for joining us on this deep dive today. Keep questioning, keep learning, and as always, keep diving deep.